So let's leave randomized controlled trials and let's move on to systematic reviews of randomized controlled trials. Systematic reviews bring all the evidence available for a therapy together by pooling multiple trials together. And we might remember that in the hierarchy of evidence, a well-conducted systematic review would sit above a randomized controlled trial. So it is unsurprising that most of the drugs and therapies that we use in everyday clinical practice will have a systematic review of randomized controlled trials underpinning them. And we need to understand how to critically appraise a systematic review. When appraising a systematic review, we broadly look again at three components. First of all, the result. What is the result of the systematic review? There will be primary outcomes, secondary outcomes, and usually in a systematic review, the primary outcome might be graphically represented in something called a meta-analysis or a forest plot. In terms of validity, one way in which a systematic review can be assessed, one component is graphically through a risk of bias chart, and roughly you can see the amount of bias inherent in all the sub-studies within the systematic review. So in terms of results, let's look at a systematic review, and we'll look at the forest plot from a review from 2018 by Illich et al. On prostate cancer screening. So here is the forest plot. Here we can see there are 4 rows, and each row reflects one large randomized control trial. This line here represents something called the line of no effect. Each randomized trial is summarized with a square being the result of the trial, and the confidence intervals reflecting the lines around the square. So if the line crosses the line of no effect, this study is not statistically significant. And systematic reviews are really useful here because rather than one expert or doctor saying that they believe this randomized trial and another doctor saying they believe that randomized trial, systematic reviews pool all the trials together. And the summary of the meta-analysis, this diamond, it's called the pooled point estimate. This is the result of the systematic review. And if this crosses the line of no effect, well, the outcome is not statistically significant. And then you wouldn't even go on to consider whether or not it is clinically significant. It's not statistically significant. So in this case, from one systematic review from 2018, which is now 7 years old, prostate cancer screening did not improve all-cause mortality. All therapies